So I think there are 4 kind of impact areas that opt-out auto enrollment work is uncovering. Number one, and obviously, as you were saying, is the numbers, right? It's pretty material when Devon finds well over 1,000 kids who just were not in the system. They were entitled to the system. They come from the poorest, most disadvantaged households, but they just weren't in the system. They're now in the system, right? And that not only are those kids going to be able to have a free school meal, saving their families over 500 quid. A school is getting another 2,500 kids per pupil to support disadvantage funding. So that's really important. Secondly, this new cohort are now going to be able to take advantage of other funding that the council or schools might make available because of free school meals, trips, uniforms, household support fund, all these sort of really important kind of tangible, practical support right now. Thirdly, we're hearing from councils that actually bringing together different teams together and working in this agile way of working is actually getting the council to think, well, hang on, what ways are there for us to look at our ways of working to be more agile and nimble and responsive to policy opportunities. And then, and probably the most important impact of all, but longer term, is from a public health lens and perspective, the role of councils and the role of local government in enabling and supporting better equity and tackling inequalities obviously came to the fore during COVID.
Of course.
But I think that what this does is with 1,000 new households of the most disadvantaged children, what and how can a council really begin to understand what wider policies that it can leverage either from national policies or local policies to really start to understand how to support those families to really, ensure better outcomes for them and their kids.